Hello, my name is Sierra. The video that I'm about to show you has been made to educate people about the terrible effects of and preventative measures against one of the most deadly diseases in the world, rabies. This virus kills thousands of people worldwide. It occurs in wildlife on Long Island, in New York City, and all over New York State. What is it, and what can we do about it? Let's see. Do you know that more than 60,000 people in the world die from rabies each year? That is equal to one person every 10 minutes. Half of the people that die from rabies are under the age of 15. Rabies has the highest case fatality of any infectious disease. It has a case fatality rate of about 100%, which means that once you have been diagnosed with the symptoms of the disease, it means almost certain death. Rabies is a zoonotic disease, meaning that the virus can be transmitted from animals to humans. Transmission of rabies is usually by bite of a rabid animal. Rabies is caused by a bullet-shaped virus of the genus Lyssavirus in the family Rhabdoviridae. It can only be seen by a microscope. Transmission of the rabies virus usually begins when the infected saliva of a host is passed to an uninfected animal. The skin serves as a protective barrier through which the rabies virus does not enter. But when the skin is broken, for example, through a scratch or a bite wound, the infected saliva of a rabid animal can enter and start to cause the disease process. The saliva of the infected animal contains the virus in masses. 1 milliliter of saliva, which is about 20 drops, can contain up to 1 million rabies particles. The virus often remains at the incubation site for a considerable amount of time. At the bite site, the virus is thought to multiply in skin and muscle cells. The saliva comes in contact with the victim's mucous membranes or open sore, and the virus begins to spread. The new virus particles travel to more body parts along the nerves, including salivary glands, where they get excreted in the saliva. The virus travels along the nerves and infects the central nervous system, quickly attacking the brain and the spinal cord. Once the virus reaches the brain, the virus continues to multiply. Clinical signs are evident, and the victim is almost sure to die a most horrible death. Early signs of rabies in humans are flu-like. They include fever, headache, general weakness, tiredness, discomfort, pain, or even itching in the area where they were bitten. These symptoms may last for days. After a couple of days, the virus targets the central nervous system, and the victims become agitated and delirious, and often begin to develop seizures. As the disease progresses, symptoms include insomnia, anxiety and confusion, slight and/or partial paralysis, mostly of the throat and jaw, making it difficult to swallow, excitation, hallucinations, agitation, hypersalivation, which is foaming at the mouth due to extra saliva, hydrophobia, which is why patients avoid water. Then, soon, an irregular pulse and blood pressure become apparent. This leads to coma and eventually heart failure, and of course, death. Rabies is a Latin word that means madness. When most of us hear the word rabies, we think of the mad dog from Stephen King's Cujo. But rabies can manifest itself in animals in a few ways. Furious rabies. This is more common and the classic mad dog syndrome that we remember from Cujo. Aggression is pronounced. The animal becomes irritable and, if provoked, will viciously attack. The animals lose caution and fear of people and other animals. As the disease progresses, furious rabies progresses into paralytic or dumb rabies, causing ataxia, which is muscle incoordination, and paralysis of the throat and masseter muscles. There is profuse salivation and an inability to swallow, therefore the appearance of foaming at the mouth. Paralysis eventually progresses rapidly to all parts of the body. Coma and death follow in a few hours. So what signs do we look for in animals that we may encounter? A general sickness where the animal does not look good. Problems swallowing, drooling, increased saliva, so it looks like they are foaming at the mouth. A wild animal appears more tame than you would expect and allows you to get close enough to pet it. This is not normal, but of course, do not pet it. An animal may have trouble moving or is moving slowly, paralyzed and laying on the ground. Obviously, there is something wrong with it. Some normally docile animals may act mad, angry and hostile, and try to bite you. Species that are normally nocturnal may be seen wandering during the daytime. If you see an animal acting strangely, call your local Department of Health. Rabies is a human and animal global health issue. It is found on every continent except Antarctica. In the United States, rabies is found in every state except Hawaii. All animals entering the state of Hawaii must follow import rabies quarantine requirements. Rabies is not a picky disease. Any mammal can get rabies. It infects a wide range of hosts. In North America, rabies is most commonly found in wildlife like raccoons, skunks, bats, and foxes. More than 30 species of bats are capable of spreading rabies. Rabies can come in cute little packages too. Puppies and kittens can get rabies. There were several reports of rabies in kittens and people exposed because it is hard to resist petting a cute little kitten. In Africa and Asia, dogs are most commonly affected. In Latin America, the vampire bats and dogs are most commonly affected. Africa, Asia, and Latin America are the most affected areas. This is because medicine and vaccines are not available in these undeveloped countries. So if someone is bitten by an animal with rabies, they might not be able to get help right away. Once the person is bitten by a suspected rabid animal, the rabies disease can be prevented. If the wound is washed immediately with lots of soap and water, and if the bitten person gets a rabies vaccine and rabies immunoglobulin promptly. The reason being is that there is a latency period between being bitten and the onset of symptoms. The latency period is subject to the distance between the bite site and the brain. For example, being bitten on the face can lead to symptoms of rabies in 1 week. If bitten on the toe, one may go symptomless for more than 3 months. For symptoms to appear, the virus must reach the brain where it can multiply rapidly and make the person act abnormal. Once a person is bitten by a suspected rabid animal, if the animal is available, one should go for a diagnosis immediately. Call your local animal control officers for help so they can catch the suspected animal, observe it, and determine if the animal is at risk for any disease. You should call your doctor. Call your veterinarian if your pet is involved. The doctor will first find out if the animal is positive for rabies. The only way to do this is to open up the animal's brain and test the brain tissue for rabies. Rabies diagnosis is done in a qualified laboratory. If the test comes back positive, the person that has been exposed to the animal is probably infected. So why are we beating rabies? Because there is a vaccine that is widely available for the rabies virus. A vaccine is not a cure. It is a preventative. Mass vaccination of dogs and promotion of responsible pet ownership is the most effective, humane, long-term solution towards eliminating rabies. There is no parenteral vaccine approved for the use in wildlife. Oral vaccines distributed in baits to control rabies in wildlife, like foxes and raccoons, have been effective. Rabies bait drops by way of helicopters have been initiated in Staten Island and parts of Nassau County, Long Island. Rabies bait stations have been prepared in Brooklyn, Queens, and parts of Long Island. Because of the increasing importance of rabies in cats, vaccination of cats is now recommended. Currently, rabies vaccinations are licensed for dogs, cats, ferrets, horses, cattle, and sheep. Compendium of Animal Rabies Control recommends rabies vaccination frequency every 1, 2, or 3 years, as dictated by local regulation laws, after an initial series of 2 vaccines 1 year apart, starting at 3 months old and then 1 year later. Globally, the dog is the most significant reservoir of the rabies virus, particularly in developing countries, for example, Africa and Asia. India has the highest prevalence of rabies in the world because of poverty, overabundance of canines, and education. Internationally, the World Health Organization, and in the USA, National Association of State Public Health Veterinarians, prepared comprehensive guidelines for control in dogs, including notification of suspected cases and euthanasia of dogs with clinical signs, and dogs bitten by a suspected rabid animal. Reduction of contact rate between susceptible dogs by leash laws, dog movement control, and quarantine. Mass immunization of dogs by campaigns and continuing vaccination of young dogs. Stray dog control and euthanasia of unvaccinated dogs with low levels of dependency on or restriction by people. And dog registration. What happens if a pet is suspected of being exposed to rabies? Where terrestrial wildlife or bat rabies is known to occur, any animal bitten or otherwise exposed by a wild carnivorous mammal or bat not available for testing should be regarded as having been exposed to rabies. The National Association of State Public Health Veterinarians recommends that any unvaccinated dog, cat, or ferret exposed to rabies be euthanized immediately. If the owner is unwilling to do this, the animal should be placed in strict isolation. For example, no human or animal contact for 6 months and vaccinated against rabies 1 month before release. If an exposed domestic animal is currently vaccinated, it should be re-vaccinated immediately and closely observed for 45 days. Any healthy domestic dog, cat, or ferret, whether vaccinated against rabies or not, that exposes a person should be confined for 10 days. Exposure means bites or deposits saliva in a fresh wound or on a mucous membrane. If an animal develops any signs of rabies during that period, it should be euthanized and its brain immediately submitted for rabies diagnosis. If a dog, cat, or ferret responsible for exposure is stray or unwanted, it may be euthanized as soon as possible and submitted for rabies diagnosis. Wild carnivores and bats presents a considerable risk when a disease is found, regardless of whether abnormal behavior has been observed. Bats should never be caught or handled with bare hands. They can inflict wounds with their teeth. Bat bites should not be ignored or go unnoticed, so direct contact with bats should be a risk of virus exposure. Any wild carnivore or bat suspected of exposing a person to rabies should be considered rabid unless proved otherwise by laboratory diagnosis. Ideally, this includes bats in direct contact with people and those found in rooms with sleeping or otherwise unaware persons. Wildlife should never be kept as pets. If your cat or dog contracts rabies, he cannot be cured. In most states, dogs and cats are required by law to be vaccinated against rabies. Thankfully, legal and educational efforts to prevent rabies have been proven successful. The number of cases of canine rabies in the United States dropped from 8,384 in 1946 to 93 in 2009. Internationally, the World Health Organization recommends several types of cell culture vaccines for human groups at risk. In the USA, the Advisory Council on Immunization Practices prepared recommendations for guidelines for human rabies prevention. Pre-exposure immunization is strongly recommended for people in high-risk groups, such as veterinary staff, animal control officers, rabies and diagnostic laboratory workers, and under certain circumstances, travelers working in countries in which canine rabies is epizootic. A pre-exposure vaccine is administered on days 0, 7, and 21 or 28. In the event of subsequent rabies virus exposure, pre-exposure prophylaxis is supplemented by a limited post-exposure regimen, 2 doses of vaccine IM on days 0 and 3. For healthy unvaccinated patients bitten by a rabid animal, post-exposure prophylaxis consists of wound care, local infiltration of rabies immunoglobulin, and vaccine administration on days 0, 3, 7, and 14. Most rabies deaths occur because the exposed person did not know what to do to avoid developing rabies. After a person has been exposed, it usually takes several days or even months for the virus to travel along the nerves and eventually reach the brain. So there is still time, even after exposure, to get vaccinated and prevent rabies. The Global Alliance for Rabies Control was founded in 2007 by leading rabies experts and is the world's foremost nonprofit organization dedicated to preventing rabies in humans and animals. Its headquarters are in the United States. Since its formation, the Global Alliance for Rabies Control has educated over 100 million people in 200 countries and territories and is the creator and coordinator of World Rabies Day, observed each year on September 28th to commemorate the death of Louis Pasteur, a French chemist and microbiologist who discovered the rabies vaccine. World Rabies Day is an initiative coordinated by the Global Alliance for Rabies Control to raise awareness that rabies can be prevented and no one needs to die of rabies anymore, since we have excellent vaccines and other rabies biologicals. World Rabies Day has been observed in 125 countries, helping to educate over 100 million people and vaccinate more than 3 million animals across the world. Educational information that can be used to increase global awareness can be freely downloaded from the World Rabies Day website, worldrabiesday.org. These materials have been translated into many different languages for use all across the world. World Rabies Day has involved an international partnership between every leading global health organization, including World Health Organization, World Organization for Animal Health, Centers for Disease Control and Prevention, and all major veterinary societies from around the world. World Rabies Day, September 28th, is a day that we should all remember to take our pets to get vaccinated against rabies. If we keep our pets vaccinated, we will not only protect their health and well-being, but we are helping to protect ourselves against the most deadly disease known to mankind. Simply vaccinating your pet is the best and cheapest way of preventing the rabies disease. This World Rabies Day, if your dog or cat or ferret has not been to the vet in a while, do yourself and your pet a kindness, make an appointment, and help keep rabies at bay. The preventative vaccination approach represents a One Health approach to disease control, leading to simultaneously better health outcomes for animal and humankind. Rabies is everywhere, so be aware. Vaccinate every year. I hope that this video has given you some new information and a lot to think about. September 28th is World Rabies Day. Let's all do what we can to try and stamp out rabies and never have to have a World Rabies Day again. It's a no-brainer! Vaccinate your pet against rabies.